Let's talk about using diet to manage bipolar disorder. My name is Dr. Dutton. I'm a board certified adult psychiatrist, and I talk a lot in this app about targeting root causes of mental illness rather than solely reducing symptoms with medication. So today we're going to talk about diet, and let me be clear that this is not meant to be a replacement for medication. It's probably best used as an intervention along with medication in most cases. However, there can be cases where this changes over time, but please talk with your mental health provider before making any significant changes to your life or to your medications. So that being said, we first need to understand a few things. Primarily, what in our diet contributes to mental health issues. So we know that things like oxidative stress, inflammation, and insulin resistance significantly contribute to metabolic issues, not only in the rest of the body, but in the brain as well. And these can lead to mental health symptoms. So what causes these things? There can be a lot of different causes, but as far as the diet, it's going to start with things like ultra processed foods, meaning foods that are high in refined sugars and carbohydrates, as well as refined seed oils and other additives. So step one, which is something that I recommend for basically everyone, is to work on cutting out these ultra processed foods and focusing on a primarily whole food diet. I guarantee that almost everyone will notice some benefit from this. Is it going to reverse your bipolar disorder? Probably not. However, it's definitely not going to hurt, and it probably will help. Other things to consider are that when someone has an intolerance or perhaps a gut issue, this can definitely contribute to inflammation, which can contribute to mental health issues. So for example, if someone has a lactose and or gluten intolerance or allergy, this can contribute significantly to gut health issues and inflammation, which can worsen mental health symptoms. Additionally, beyond those sorts of common things we think about, like dairy, gluten, egg, soy, there are also other food groups that can just be difficult for people to digest and absorb the nutrients from. So for some, this includes things like nuts, seeds, legumes. So these are the things that they eliminate on a paleo diet. A paleo diet is going to be whole foods, but mostly fruits, vegetables, and meat. It does not include dairy or legumes. However, I never say that someone has to adhere strictly to a diet. I always encourage that people find a diet that works best for them. Another component of diet is diet timing. This can be especially helpful in bipolar disorder because the timing of your meals is important for your circadian rhythms, which is important for preventing mood episodes. So ideally, we would be eating only when it's daylight out and fasting when it's dark out. Now, of course, this can be difficult to do in the winter when the days are pretty short. And so during these times, I do recommend waiting till it's light out to eat breakfast and then trying to stop eating like 3 or 4 hours before bed. And then there can be more drastic dietary changes that, of course, do have some risks and are more difficult to implement, but they also have higher potential rewards. So, for example, a ketogenic diet, we have lots of evidence to show that this can be a really helpful intervention for reversing bipolar symptoms. It was originally developed as an intervention for treatment refractory epilepsy, and it's shown to be pretty safe and effective in those populations. And we're finding that more and more it can be helpful for mental health conditions as well. And the most extreme version would probably be a carnivore diet, which not every carnivore diet is a ketogenic diet, but a carnivore diet does eliminate a lot of those potential irritants or things that people can't digest. So if someone has a lot of autoimmune issues and inflammation going on, then it could be worth trying at least as a short-term intervention. But again, these last two especially, I would talk with your provider, both mental health and medical provider, to make sure that there aren't any contraindications or reason that it would not be safe for you to try. So this is, again, broad strokes. If there's something I talked about here that you want to hear about in more detail, then let me know in the comments. I'm also putting together an email list for those of you who are interested in my content because I may have future courses or offerings and I want to be able to communicate directly with you all about those things. So if that's you, then send me a DM with your email and I'll see you in the next one.